Thanks everybody for coming. I'm really excited to tell you about this center. Preparing for this helped me think through, crystallizing all the information, and also is helping me think through how to engage all of you guys so that you want to come and work with us. So I'll just blast through this.
It's not on those.
What's that?
The PowerPoint's not on. I think you just have to drag it over to the other window.
Yeah, sure. Let's stop sharing.
Sharing.
And
Here, Ellen.
oh, that isn't right now.
Just drag the PowerPoint onto the other screen.
Well, I have to.
How does it?
There we go. Yeah, it's sharing. That's why it's on the current slide.
Share that information with how we.
Okay,
Great.
great. I can't see you guys over there, so.
You can lower the podium probably.
Lower the podium.
Lower the podium.
There you
go. Can you see above everybody?
I can.
Okay.
Oh, great. This is great. All right. So what I'm going to talk to you guys about today is just some background in agricultural injuries, illnesses, and fatalities. I'll give you a little bit of background on NIOSH Centers for Agricultural Safety and Health. I'll talk about hired migrant and seasonal farm workers in the US, which is the focus of our Ag Center. And I'll describe all the different projects and everything in our center. And feel free to interrupt me if I'm not clear about something, but maybe we can hold discussion, real discussion until the end. And I will try to do this in 30 minutes so that we really have time to talk, okay? Okay. So just by way of background, if you look at fatalities by economic sector, agriculture has the highest rate of fatalities of any sector of the economy, followed by transportation and warehousing, and then construction, and then everything else is a lot less. So ag is very dangerous, kills a lot of people. And if you look at non-fatal work-related illnesses and injuries, agriculture wins again. This is from the BLS survey of occupational illnesses and injuries. And the rate of non-fatal injuries per 100 full-time equivalent workers is high. These are the mechanisms of injury.
Just keep going. They can't see it on Zoom. So I'm going to try to.
Oh, they can't see it.
No.
Just a second. Oh, did I not?
I think
I
you stop
have to
sharing.
unshare and share. Okay.
So here's the Zoom thing. Go to where Elena is. And then do share. Yep, and then go back to your presentation share. Okay, should be good.
Is that working?
Yeah, we're good. Thanks.
Okay. So these are the mechanisms of injury in agriculture. Tractor overturns and vehicle accidents are the biggest cause of death in agriculture, predictably, I guess. And then falls is next. And then all of these other mechanisms are prominent in agriculture. So very dangerous. And then, I always frame diagnoses, or I'm sorry, hazards into these 5 categories: chemical, biological, physical, biomechanical, and psychosocial. And then I think through what falls into those categories in each sector. And so in agriculture, pesticides, gases, organics, fuels, lubricants are common. Infectious agents, of course, because soil has a lot of infectious agents in it, and so does livestock. There's heat, UV light, cold dust, biomechanical problems are hazards are huge, from acute trauma to cumulative trauma. And then there are psychosocial hazards in agriculture, as there are in every sector and every occupation. But in agriculture, they're particularly difficult, I think, working long hours, harassment, low pay, wage theft. Those are all quite prominent among farm workers in the US and globally, I think. So NIOSH has had these agricultural safety and health centers for, I want to say, like 30 years. And this is the first new one they've had in at least a decade, maybe more than that. And so what does NIOSH want to do with its ag centers? It wants to develop and conduct research. It wants to do educational outreach to communities and to students and people, practitioners who can benefit by education and carry that out into the field. NIOSH is also interested in developing control technologies and model programs, administrative type programs, training programs, and doing consultations and communications to all the players to try to reduce illnesses and injuries among farm workers. And so prevention and control are really important, and that's been the framework of NIOSH and OSHA until pretty recently, when it has begun to realize that well-being and sort of more resilience, well-being, and more positive aspects of employment are also important to promote. So here's where the ag centers are. We're number 12 with Root. Very happy about that. And now I'll just tell you about our center. So let me start with telling you about Illinois for a minute. There's a population of about 12.8 million people in the state of Illinois. And reportedly about 1.7 million people live rurally. But you can see from this map that, you know, the biggest population concentration is in and around Chicago. So somewhere close to 9 million people live up. Can I see that? Oh, you can't see that anyway. Sorry. Up here. Yes. Okay, so somewhere up around 9 million people live here, and the other 3 million people, you know, live in other parts of the state. 71,000 farms, separate farms in our state. We do have a lot of small farmers in our state. We have plenty of agribusiness too. It's the 5th highest state in terms of the gross domestic product put out, or the cash that comes in to the US for agriculture. We're the pumpkin capital of the world. How many of you guys knew that Illinois is the pumpkin capital of the world? Now you know more pumpkins than any other jurisdiction in the whole world. We're in the US, we're the 2nd in corn and soybean production. We're somewhere between, we fall between the 4th and the 9th in hog production, depending on whether you're counting the weight, the exports, the income, but somewhere in there. So an important pork producer. And then horticulture here is really big. We have greenhouses, orchards, small fruits and veggies in the field. And probably none of you knows that my major in undergrad was small fruits. Honest to God, at Michigan State University, I majored in horticulture, and we had to focus, and I was very interested in small fruits, and I still like to eat them, but my career took a different turn. We have beef and dairy and poultry in the state as well. And so what about farm workers? You know, this I'm observing, and I have done a literature review trying to look at all the literature about farm workers, and they're called so many different things, and the definition of who they are and what they do is so varied that it's really difficult to target that in the literature. But anyway, so this terminology of hired, migrant, seasonal, farm workers are kind of the key words that define this population. So that's different than farmers, farm owners, agribusiness, people that are working all year round, you know, and the fact that they're hired during a certain period is important. There are approximately 2.5 million farm workers in the United States and around 55,000 in the state of Illinois. And that counts everybody that works in farm work during the summer. So people are not working full time or around the calendar. So there are 55,000 separate human beings supposedly that work in Illinois. It's a very hard number to get. 80% work in crops, 20% in livestock. The majority are men. The mean age is in the 40s, although there are a lot of young farm workers that are doing picking of crops in the fields. The majority are foreign born, speak Spanish, and somewhere around 50% of farm workers across the US lack legal status to work. So they're so-called undocumented workers. And then farm workers themselves, yeah, Shelby.
So this data, is this just what you're defining as the hired migrants?
Yes. Yes. Exactly, just the hired migrant and seasonal farm workers is what I'm talking about now. So it turns out that those workers are not a monolith, but there are pretty big differences in groups of migrant and seasonal farm workers. It turns out that about 80% of them are settled in the United States. They live in Illinois year round. They may be you know, legally authorized to be here or not, but they're settled in the United States and they shift into agriculture in summertime and they do other jobs during the year. About 10% of those are so-called shuttlers. That's a term that's used in farm worker, you know, literature. And those are people that travel more than 75 miles for work. So you could live in Aurora and then travel to the southern part of the United States to work. Those are called shuttlers. 5 to 10% follow the crop. So that's, I think, what most people think of when they think about farm workers, that they live in the southern United States, in Florida, Georgia, Texas. They work there during the ag season, which is fall and winter. And then when that season ends, which is sometime in the spring, they begin to migrate north and they pick crops, you know, plant and pick crops seasonally. So they end up coming to the state of Illinois in summertime, May through October mainly. So that's the follow the crop workers. This 3% is the wrong number. That should be 10 to 15%. So 10 to 15% cross the southern border of the United States. Some of them cross on an H-2A visa. That's a work visa that's specific for agriculture. It's a short-term visa where you can work for a single employer for a couple of years. You can go back and forth with that visa. It's changed a little bit. It changed a little bit during COVID, but basically it's what I've just told you. And then in that group also are people that come across the border illegally. They're not on a visa, but they come here and they work in the summertime and they go back across the border at the end of the year. Nobody really knows too much about that group. Okay, but it's probably a very large number. Shelby.
So would this group also include then, you know, maybe teenagers on summer break?
Could be. So if you want to look at how this has changed over time, the numbers that I've given you are around this, 2014 to 2015, but the proportions changed. So there used to be only 6%, I'm sorry, only 60% settled as opposed to over 80% now, and something like 40% migrant as opposed to 20% now. And the conditions of migrants in the United States are similar to migrant farm workers all over the world. They're often coming from a lower socioeconomic status country, so-called low and middle income country, to a higher income country, and doing this work in that country that people that live in higher income countries don't want to do, because it's very hard work. So I think that farm workers are the quintessential underserved and disadvantaged worker population in the United States. They have very short-term labor contracts. They're paid very low wages. They're often paid in cash or off the books. Informal sector is how international organizations like to call this group. They have no social benefits, no insurance, no paid sick leave. They're not entitled to workers' compensation in the state of Illinois, although that is different in different states. They often don't know their employer. They work under a crew leader, and they might know that person's first name, but they don't know the big boss at the top. Work is far away from home. Very far away if they're coming across the border, and even far if they're settled in Illinois and working 100 miles away from where they usually live. The work is remote, and therefore it's hidden, and so that sets it up for egregious violations by employers, crew leaders, and so on. And I would say that we're all in collusion, the workers and the employers, to not rise to the attention of authorities, of organizations and agencies. They live in pretty poor housing usually. It could be makeshift. There are labor camps, but there actually aren't that many labor camps. H-2A visa holders, the employers that hire H-2A workers through the H-2A visa program have to provide them with housing, and then some other employers provide housing. But most farm workers don't live in any employer provided housing. So there aren't so many labor camps in the state of Illinois. There are tents, buses, apartments that are shared with lots of people in the same building or the same apartment, often with strangers. So you can imagine that's pretty fraught. And these workers tend to have a lack of knowledge of employment and occupational safety and health rights. And even if they know what their rights are, they're unlikely to exercise those rights for all the reasons you can imagine. And I would be remiss if I didn't talk about upstream issues that lead to the circumstances of farm workers here. There's induced migration. People are fleeing or leaving countries where they can't make a living or where there's a lot of violence. Neoliberalism refers to trade policies. And so when we subsidize farm owners for who grow corn, and Illinois is a big corn state, we subsidize them, and then they flood the Latin American market with corn from the United States. It undermines the economy in Latin America, and that's a big part of the Latin American economy, and it drives people out of the country to find work. The H-2A visa, it's a cool idea, but when you think about it, it was crafted to hire foreigners into jobs with low wages and work that American citizens don't want to do. I think we have an ostrich approach, which I alluded to earlier, which is that we all want these people in our country doing this work because they're an integral part of the food supply chain. Yet we don't want to acknowledge that and set up, legal and safe ways to have them come into the country. And I would say that's true about restaurant workers and home care workers and elder care workers and a whole variety of occupations that I think all of us are in collusion to keep at a low status in our economy. There's also this phenomenon of agricultural exceptionalism. I don't know if you know that the agriculture sector, because of its integral importance in our economy and our food supply is actually accepted from a lot of the regulations that govern other workplaces. And so their minimum wage is lower, they're not entitled to benefits. Children can work down to the age of 12 legally and get paid for their work. They don't get social benefits. OSHA doesn't oversee all aspects of them. You know, the EPA oversees pesticides, and this is the only realm where the EPA is looking at workforces, and that isn't governed by OSHA, for example. And environmental protections are also not afforded this group in the same way. Agriculture is dangerous. I already told you that. And so I think that, you know, that this concept of intersectionality, which you probably have talked about in different classes, IPHS 401, for example, that this lack of wages, social benefits, poor housing, transportation, limited opportunities that are piled on social hierarchies and lives of poverty, there's physical violence, lack of rights, and dangerous border crossings. I would say that this is a recipe for considerable disadvantage and harm to this population. Okay. So that's all the background. I'll zip through the center then. So the goal of the center is to implement strategies and actions leading to systems change that protects and promotes the health and well-being of farm workers across the US. Lofty goal, right? We want to conduct high quality research. We want to build and strengthen multi-directional collaboration and engagement because we understand that many entities touch this issue and these problems, and we need to link arms with state agencies, government and non-government organizations, business to address these problems. And then the evidence that we are able to elaborate through our research, we want to translate and disseminate to promote policies and practices that will benefit this workforce. And so this is a very typical structure of NIOSH. I'm going to go to this one. So let me get rid of that thing off the top of here. Can I get rid of back? Sorry. Get rid of this thing off the top.
If you click more, you can do hide floating meeting controls.
So this is a NIOSH special. They have a center, you know, that they call evaluation and planning at the top. There's a research core and there's a communication and outreach core. That's what NIOSH has in all of their programs. It's in the IRC, the Center for Healthy Work. And so this is our structure. And we have we put in 4 separate R01s, research proposals into our original grant proposal. The first 2 got funded. The second 2 did not get funded, but they've been resubmitted. And this outreach core that we have includes Community Health Partnership of Illinois, Legal Aid Chicago, and UI Extension. And I'll tell you about all 3 of those, but those are integral components of our center as a whole. This is not solely a university deal. And we work with UIUC as well as UIC. And then we have a couple of other tandem research projects. So the idea of an ag center is that you're reaching across the states and you're collaborating with other states and doing research together and providing, you know, outreach and research translation and all of that to other states. And the model is very regional, but we focused on this population, and so we think our region is the whole United States and hopefully globally as well. this is the group, and I'll tell you more about different people on different projects. But here's the UIC team. These folks are from UIUC. Tessa's from UIC too, of course, and some of these other folks who you recognize. We have a couple of researchers from urban planning and a couple of researchers in anthropology and communications at UIUC. And then this is Legal Aid Chicago Community Health Partnership. And there are community health workers from Community Health Partnership involved. Lupita Quintana, sitting right there, is involved with the center. Jibazor, newly minted PhD, who is now postdoc in eohs. And then we have a couple of collaborators that we're starting to work with in Florida. So Community Health Partnership of Illinois is a set of 6 federally qualified health centers. It was established as a migrant clinic in the late 1960s, 1970 to be exact. In the 1960s, the US had a program of rural health clinics that served farm workers, and then it developed into what is now the FQHC system in the United States. And so they do outreach to rural populations, including farm workers. They serve around 8,000 farm workers a year, and they have community health workers, formerly promotores de salud, health promoters, which was a less formal job classification. We're also working with Legal Aid Chicago, which has an immigrant and workers rights section, and they have a group that focuses on farm workers per se. They're particularly focused on H-2A workers, but they do out in the field. There's a mixture everywhere they go, and so they address the needs, legal rights, and some health and safety stuff related to farm workers. This is who they are. Sorry, I didn't know this would lay out like that. So they deal with a lot of employment conditions issues, and that's that. And then Illinois Extension. So you know that land grant universities were established in the United States in the 1800s to serve farmers and their families and educate the population of the United States, which was very rural back then, but isn't anymore. So UIUC is our land grant in the state of Illinois. And as part of the land grant thing, there was extension was developed for the land grant to go out into the field and interact with people and a variety of ag-related things out in the field. There are 27 different areas in the state of Illinois, offices that do outreach, and this is their infographic about it. They interact with a lot of people out there, and so that's a great partner to have. Josie Rudolphi and Salah Isa, part of their faculty salary at UIUC is to work as extension. So this is a vision for the center that I drafted. Really, I drafted myself and I showed it to our group and nobody objected, but I'm still calling it a draft because I think we have to bless this more carefully. But anyway, I feel there are a lot of people that have focused on farm workers in the United States for decades. There are researchers, there are federal and state organizations, there are NGOs, there are people that are doing a lot of work. And so what we are not, we have the humility to say that we are not leaders or the first or anything like that to address these issues. We want to collaborate with the people that are doing this. We want to use their research. We want to use their connections and all the organizations that touch this. And we would like to move the needle on this issue because honestly, to me, it doesn't look like the needle has been moved on the issue since I don't know, for 75 years, if not more. So we, our research is very focused and targeted. It's, we want to find practices that work locally and globally. So our interventions are with that in mind. We want to identify policy voids and policies that are in place but are not followed or are ineffective, and we want to change those. We want to continue to monitor the situation and fine tune these policies and all of our efforts. And so again, we want to engage farm workers and rural and agricultural communities to help us figure out what's important and how to structure our activities. And we want to tighten the networks, conduct excellent research, effective outreach, and develop internal and external supports for all of our activities. So first we need to get the lay of the land. And we're in the process of conducting an environmental scan. We have a slew of students now that are signed up and looking at all the clinics that serve farm workers, state agencies, NGOs, and other organizations. We want to build networks with them, and we want to conduct a census of sorts of farm workers so we have a better idea of how many there really are and where they are and how they can be reached. We want to create knowledge. I won't talk about that. And we want to do communication and outreach. So let me just tell you very quickly about our research projects. The first is called Measuring Farm Worker Health and Wellbeing, where Tessa is leading this, and we're trying to develop a survey tool that can be used for farm worker populations. NIOSH has they just developed a survey tool called the wellbeing, but they haven't tried it in any populations yet. And it looks to us like it's really designed for people working in more formal employment in factories and hospitals and stuff. So we're working on adapting that by reviewing the literature, crafting a survey tool, testing it, and then we will roll it out in among farm workers. And then hopefully we'll have a survey tool that we and other people can use. The second is Lee Friedman's project. So he is the PI of the Illinois Agricultural Safety and Health Surveillance Program. And so this is doing the occupational illness and injury surveillance that is already being done in the state of Illinois and expanding its reach to include agricultural and farm worker communities, which are not part of the regular surveillance program because those numbers and the data are very hard to get. And so he's doing, looking at the data sets that we already get, hospitalization, workers' comp, and so on, to see if we can identify farm workers in those. There's also an informatics project looking at the electronic medical record of Community Health Partnership of Illinois to try to see if we can pull out farm workers and farm worker illnesses and injuries among all the patients that they see in those 6 clinics. And there's a third. Oh, right. And then give the data to those who need to know to use the CDC surveillance window. So the third project didn't get funded, but and this was put in by Jessica Brinkworth et al. She's a biological anthropologist, which I learned a lot about from just talking with her and meeting with her. And I have to say this proposal got put together in a two-month time period. And so a lot of our connections were cold calls to people like, hey, you wanna join us? I know you're doing tandem things, including our CUPA urban planning folks, which has turned out to be really rich and wonderful collaboration. Anyway, Jessica Brinkworth does transcriptomics. That's what her work is. And So I'm not going to pretend that I could explain that in a very big way, but what she wants to do is to look at the various farm worker populations, conduct a survey of demographics, health and work exposures and stressors, and then look at the transcriptome of that population. So draw their blood and look at the stimulation of genetic transcription based on the historical survey item data that is collected, and compare that across groups. Is that too simplistic, or is that okay?
Yeah, that's good. Basically, so yeah, so your DNA is static, but your genes, how they're expressed and when they're expressed can change over time based on exposures. So the transcriptome is saying, looking at how different parts of your genes are expressed differently after infection, and how that might vary based on the different stressors that the individual has experienced over their lifetime.
Thank you.
You're welcome.
So there'll be a statistical comparison of transcriptomes modified by labor status, social stressors, and supports for the 3 different farm worker groups, and then farm workers versus a referent population that isn't farm workers. And the 4th project is called Characterizing and Fostering Farm Worker Resilience. Sheree Thompson is a communications person at UIUC. And so what she is proposing is to do focus groups and present that back to communities, and also give them cameras to take photographs of their surroundings and come back and talk about their issues and their perception of what is happening in their workplace. Sorry, so that's also simplistic. But anyway, that is going to get, those 2 are going to get reviewed in a March, study section review. And I just put the slide in here so you can have the slide set if you want. And I love logic models. I used to hate them, but now I love them because you can really see just a list of what you said you were going to do and your outputs, your outcomes, and it's a nice roadmap for your life. We're also attaching other research projects to this. So NIOSH will only fund the ones that I've already showed you, but in the Illinois Occupational Surveillance Program, that's the thing that Lee Friedman, G. Bazor, and others are working on. We have a pesticide-related illness project inside that surveillance program. That's Lupita's PhD work, and so it's the same players really, and so we're marrying it because all of it, there's synergy in the connections and survey tools and all of that stuff. So that's one thing. And then the goal of that is to create a statewide reporting system for pesticide-related illness, pesticide poisoning, which we don't have in the state of Illinois. And Lupita will probably talk about that, her work in different forums that you'll be able to hear about. And then right after we got funded, we were contacted by Paul Monahan in Florida. He's a medical anthropologist, has done farm worker work for decades. And he just completed a study on heat-related illness over a 3-year period where they observed farm workers in the field, their work practices, did a training, and looked at before and after work practices and specific gravity of their urine as a marker of hydration. We're also writing a grant proposal with University of Florida to do a heat climate dashboard that's focused on farm workers in Illinois and Florida. And I already know some of my colleagues here might be interested in collaborating. Okay, sorry, it went a little longer, but that's it. Anybody have questions? Perfect.
Have you considered expanding this? You know, it's not big enough, so. I was just wondering, like, if you've considered actually measuring exposures of any of these people typically related to pesticides or
Yes,
anything like that.
yes. I think we have to, right, I have we considered looking at exposures? Yes, I mean, I think that, first of all, we could only put in 4 grant proposals and we had to write the whole thing in 2 months. So this is the way we conceived it. But I think that once, you know, once this is stood up, like we're working on the website, you know, like once we're a partnership and we all know each other and these projects are going, I'd say in year 2, we'll be ready to think about connecting other research to it. NIOSH has, you know, funding limits. So the funding for additional research projects, you know, unless we can, you know, sequester some of our funding for them, we don't really have extra funding for it. But we have personnel and interest and an infrastructure for writing more grants and looking for other sources of funding. And we definitely want to do that. I don't know how that works with federal agencies, like what they think gets encompassed and included in a center if you're getting funding from somewhere else, but I'll figure that out. So there's people here probably know, but I don't. What else?
I think it was maybe the slide after the pumpkin slide, there was like a map of migrant workers by state and it looked like Tennessee was just blank. Do they not report those numbers?
Yes, they don't report. That's why they're blank. They don't report to that system. That's why they're blank.
Okay.
You know, that came from USDA has this beautiful website. If you're looking for data ever on agricultural communities, the US Department of Agriculture has this beautiful website. They do a survey every 5 years. They're doing one right now, but it won't be available till 2023 or 4, and tell you all these things about agriculture across the United States. So I guess they're not included. Yeah.
How does the community receive centers like this and projects like this? You know, whether that be the actual workers themselves, how do they receive that? Like, what are
How
the
do
feelings
they
in there?
receive
And then also, how do, you know, the actual employers receive this?
Yeah, that's the critical question, I think. You know, I think that farm workers need to be an integral component of the center and setting it up, be on an ethics board and vet projects and programs that come out of this. And as it rolls along, we will develop that aspect. You know, just the way it got stood up didn't really allow for that to be incorporated initially, but I think that's the most critical part of the whole thing, because it doesn't matter what we do at the university. It matters what happens out in the field. It matters what policies get changed. It matters how employers practice, you know, or you know, observe these policies. And so I think that's really important and really bears a whole kind of workshop brainstorm. I think that has to be on our list of activities. So
Including those farm workers too.
well, farm workers and employers. So I think the buy-in from farm workers, buy-in is not a problem with farm workers, but buy-in of employers can be tricky. And we're working with trade organizations. Extension, you know, reaches out to employers specifically, so we're mindful of it. And I think that employers, you know, employers want to do right. Employers don't want to hurt their workers. they want to do right by their workers. And so I think we just have to, you know, carefully craft and think that through, but yet also critical.
Linda,
And, you know, just writing, you know, it's the problem of writing a grant proposal that fast.
Linda,
What else?
Linda, can you hear me?
Was there a question?
No, we can't hear you.
Oh, we can't hear you, but, oh, how would I? Talk again.
Can you hear me?
No. I don't know how to make it.
I think.
Just a minute.
Can you hear me now? How about now?
Just a minute, we can't make your voice,
That's John.
I know.
okay.
Try speaking now.
Can you hear me now?
The computer muted, like the.
I don't see a sound
So I'll
option.
just take this quick second to say there's pizza around the corner, so it really is a little cafe.
It's okay. I don't want to interrupt it if you can't, if it doesn't work. I don't want to ruin the last 10 minutes.
Coffee and things up on the 10th floor for after, so that you can continue to talk when they're over, but they're here for everybody.
Might be able to search for this.
So there's a lovely garbage can over there. If you take the paper plates, that are actually compostable. So throw those away in the compostable garbage bin. Otherwise, everything else can go in standard landfill.
There's a different speed rating.
Try now.
Can you hear me?
No,
Don't worry. It's okay. It's okay. I don't want to.
Type it in.
yeah,
you
maybe
can type
text
it in
it.
later.
Okay.
Elena's typing it. We'll get the IT figured out too, but as Elena's typing. I want to say thank you, and I want to ask Linda, what was your favorite small fruit?
Blueberries.
Blueberries.
I'm from Michigan. Michigan used to be the blueberry capital of the world. I don't think it is anymore, but I worked for Extension when I was undergrad student for 2 years and drove around in a truck and looked at tomatoes and blueberries and stuff. Well, let's see. Have you considered looking at it? Oh, wait. How does the community, farmers and
She hasn't
farmers?
done it yet. Those are the other questions. She's
Oh,
still, Elena's still typing. Do we have another question here?
I had, Linda, one of the really impactful lectures that you gave when I was a student was describing your experience going down and picking fruit in Florida. So I was wondering if you could just describe that really quickly and how that influenced this proposal.
so let's see, I did another farm worker project in around 2000. It was a 5-year project. And it was with Paul Monahan at University of Florida. And we were doing an eye injury prevention project. We were invited by a community. You know, they identified eye injuries as a problem in Illinois and then also in Florida, as it turned out. And so we did a project with Community Health Partnership of Illinois here in Illinois, where we did a training intervention program and looked at injuries before and after and so on. And then we did it in Florida. And I was invited to come down and pick oranges with the group in Florida. That's where the workers worked. So getting poked in the eye when you're picking oranges is a big deal down there. And I have a very nice photo of it, in fact, but we had to climb a ladder and stand inside a tree and hand pick oranges off the tree. And we wore this kind of sling and a big bag, like a big sack around our shoulders, and it hung down. And you could get up to, I forget, 20 pounds or more than 20 pounds of oranges in that sack. And then you climbed down the ladder and you opened you kind of womped the sack over a big bin. And you opened the bottom and the oranges would roll out into the bin. That is how you picked oranges there. And we all of us from Illinois went down there and picked oranges with those guys. Side by side with farm workers, watched their, looked at their eye injury potential and so on. And
And you lasted half a day.
Oh, yeah. No. It's unbelievable. I mean, the ground is uneven. You kind of stuff the ladder in the ground. It's just leaning up against a tree. It's, wobbling. You're supposed to get every single orange, like not leave one orange or two oranges. They're called shiners. And everybody, it's between making fun of that person who left a shiner and actually penalizing them for leaving a shiner in the tree. So you have to pick every single orange, and then the workers get paid by the weight. So they don't get paid by the hour, they get paid by how much produce they put in the bin. And so the people that pick fast, do better than the people who don't. The people who are stronger and can put more poundage into their sack do better. It's horrible. Really
So how did they
horrible.
get the eye injury? I'm still trying to.
They would just get poked by the branches, like they're
Oh.
standing inside the tree, so that's one way, but then there are pesticides there and they rub their eyes. There are other chemicals on the trees. There's UV light. They're standing out in the sun.
You can also imagine if you're getting paid by how fast you pick, you're going fast all day long. So
All
you're
day
not
long.
looking, you're just like, boom, your face turns right into a little branch. And you're not paid by picking that,
Yeah.
that what's called piecework.
Yeah, paid by the piece.
So dangerous.
Yeah. Let's see. Oh, Elena was going to respond to the question about how they receive work. She worked with farm workers in Florida. It depends on their legal status, H-2A versus undocumented versus domestic.
Well, I got 5 till I know people have to get to class. So thank you very much. Thank you, Dr.
No.
All right.